COVID-19 information for employees and visitors. Facts about COVID-19. A novel coronavirus is a new coronavirus that has not been previously identified. The virus causing coronavirus disease 2019, COVID-19, is not the same as the coronaviruses that commonly circulate among humans and caused mild illness like the common cold. COVID-19 is caused by a coronavirus called SARS-CoV-2. Coronaviruses are a large family of viruses that are common in people and many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can infect people and then spread between people. This occurred with MERS-CoV and SARS-CoV, and now with the virus that causes COVID-19. Protect yourself. Know how it spreads. There is currently no vaccine to prevent COVID-19. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person between people who are in close contact with one another within about 6 feet through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. Steps everyone should take. Wash your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact. Avoid close contact with people who are sick, even inside your home. If possible, maintain 6 feet between the person who is sick and other household members. Put distance between yourself and other people outside of your home. Remember that some people without symptoms may be able to spread the virus. Stay at least 6 feet, about 2 arms length, from other people. Do not gather in groups. Stay out of crowded places and avoid mass gatherings. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Cover your mouth and nose with a cloth face cover when around others. You could spread COVID-19 to others even if you do not feel sick. All employees working outside of their home are required to wear face coverings in accordance with public health guidelines. Cloth face coverings may not be placed on young children under age 2 or anyone who is having trouble breathing, unconscious, incapacitated, or otherwise unable to remove the mask without assistance. The cloth face cover is meant to protect other people in case you are infected. Continue to keep at least 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. Exceptions to face covering rule. Face coverings may be removed when the employees are working alone in a single office with the door closed, in a vehicle that will be used exclusively by the driver, eating or drinking, working alone outside in an area where it is unlikely that others will come within 15 feet. Cover coughs and sneezes. If you're in a private setting and do not have on your cloth face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze or use the inside of your elbow. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Clean and disinfect. CDC EPA cleaning and disinfecting guidance. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. The Healthy Schools Act requires additional training for all school employees using disinfectants. Maintenance and operations will supply materials for disinfecting workstations. Symptom screening. Screen yourself for symptoms. If you're planning on visiting one of our work sites, you should screen yourself first at home. Check for a temperature above 100 degrees and symptoms. If you have a fever or symptoms, you should stay home and contact your supervisor. An online screening process is in development. Watch for symptoms. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, sore throat, new loss of taste or smell. This list is not all possible symptoms. Other less common symptoms have been reported, including gastrointestinal symptoms like nausea, vomiting, or diarrhea. SDCOE screening procedure. All employees will be screened as they arrive at the main campus. The main campus and the screening station will be open from 5:45 a.m. to 3 p.m. Monday through Friday. This is a phase 1 of a process we expect to adapt for our other work sites. All employees and visitors at the main campus will be required to check in at the front entrance. Only the main parking lot and the front entrance will be accessible. Those who are symptom and fever-free will get a sticker to attach to their SDCOE ID badge. All employees will be required to wear their SDCOE ID when at one of our sites. Anyone who has a fever, symptoms, or has been in contact with someone suspected of having COVID-19 will be sent home to self-isolate and contact their supervisor. Friends and family members will not be allowed to visit SDCOE work sites while restrictions are in place to prevent the spread of COVID-19. Screening questionnaire. The online questionnaire has 2 questions. Do you have any of the following symptoms? Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. 2. Have you or someone in your household had close contact with a suspected or known COVID-19 patient? Spent longer than 15 minutes within 6 feet of someone who was sick with a fever and cough. When to seek emergency medical attention. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. This list is not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. Safety procedures. Safety procedures for stairs and elevators. No more than 2 employees will be allowed in an elevator at any time. Employees must wear face coverings and face away from each other while in an elevator. Markers will be placed in the elevator and in front to ensure a safe distance. On stairs, employees should follow posted signage and maintain a safe distance. Employees heading downstairs must yield to those going up. Safety procedures for restrooms. Employees should use the restroom in their immediate area building, except in an emergency. Use will be limited to no more than one person at a time. Employees must wear a mask when in the restroom. Use toilet seat covers and clean and disinfect touched surfaces using available supplies. Wash their hands and should use paper towels when touching fixtures, such as door handles. Safety procedures for food. Employees should not share food or utensils. Shared refrigerators, microwaves, coffee makers, and water coolers will no longer be allowed. The main campus cafeteria will be open for limited seating and limited service, such as a limited menu of prepared and takeout items. There will be no employee access to utensils, condiments, napkins, cups, coffee, or drink dispensers in the cafeteria. Where to get more information. All available information that employees need is available on Common Ground, including frequently asked questions about COVID-19, updates from the superintendent, information from the reopening survey, resources for working remotely, information from insurance providers. Employees can also look for regular updates in This Week as well as emails from the superintendent or human resource services with more urgent information. Have questions related to COVID-19? Email covid-19-hr@sdcoe.net if you need additional information related to leave time or procedures, you need support with Family First Coronavirus Response Act or Public Health Emergency Paid Family Leave. You, a household member, or someone you supervise tests positive for COVID-19.